Good afternoon, everyone. My name is Michaela Denny, and I serve as Education and Training Director with Voices for Florida and the Open Doors Outreach Network. I'm very pleased to welcome you this afternoon to our Perspectives webinar titled Sex Trafficking of Boys and Men. And I wanted to take a moment to introduce you to our facilitator, which is Nathan Earl. Nathan Earl is an anti-trafficking pioneer, fierce advocate, and visionary leader with a passion for building resilient communities immune to exploitation. Through his work as the principal consultant at Giant Slayer Communications, Nathan leverages lived and professional experience to help organizations and communities prevent violence against boys and men, including human trafficking and exploitation. Mr. Earl is a 2019 Fellow of the U.S. Department of Health and Human Services Human Trafficking Leadership Academy. His educational background includes a business degree from the State College of Florida and is a current student at the University of South Florida. Mr. Earl has earned a certificate in leadership from Coro Southern University and a certificate in human subjects research from Florida International University. We're so pleased to have Nathan here as our facilitator, and he will introduce the rest of our panelists. Thank you.
Thank you, Michaela, so much. And good afternoon. Thanks so much for being with us today. It really is an honor to be able to moderate this conversation with such an all-star cast around the topic of the sex trafficking of boys and men. And quickly, before I introduce the panelists, I just wanted to mention that some of the content that we'll be discussing today may be trauma reminding for those with histories of sexual harm. And to just be sure you're taking care of yourselves throughout the presentation. So without further ado, we have the first panelist to introduce is John Long. Mr. Long is the Executive Director of the U.S. Institute of Human Trafficking. John oversees day-to-day operations and maintains a safe, positive environment where the home's young men can begin the journey towards recovery. The Safe Home is the first home dedicated to the care of male victims of sex trafficking under the age of 18 in the United States. He also works to build relationships between the surrounding community, the Safe House, and its various partners and providers. John, it's good to be with you today. The second panelist is Marta Lucia Marin Kuhn, LCSW. Ms. Marin Kuhn is an experienced mental health clinician, educator, and consultant. She brings a unique lens informed by her background in business management and victim services. Currently, Marta is a trauma therapist at Kaiser Permanente in the Northern California area. In addition to her clinical roles, Marta has assisted organizations in their efforts to better serve survivors of gender-based violence. Marta is the former managing director of 1 in 6 Inc., where she spearheaded programs including the Men on Campus National Task Force and the 1 in 6 Inc. online support group for male survivors of sexual abuse. Other notable leadership positions include chair of the Northeast Florida Human Trafficking Coalition, Peace Over Violence Child Abuse Prevention Advisory Committee, and volunteers therapy services for LGBTQI+ and Spanish-speaking communities. Marta holds a master's degree in social work from California State University, Sacramento, and a business management degree from the University of North Florida. Marta loves traveling with her wife and saying the phrase, "You are worthy," to anyone who will listen. You are worthy. I love it. And we also have Nilda Otero. Nilda started off in child welfare in 2013 as a volunteer with the Guardian Ad Litem program, where she gave a voice to those children unable to advocate for themselves. While raising her son on her own, she managed to put herself through college and obtain her associate's degree from Pasco Hernando State College in 2015, and her bachelor's in behavioral health community science with a concentration in children's mental health and criminology at the University of South Florida in 2017. She's now proceeded to continue her education at the University of Central Florida to obtain a dual master's degree in public administration, nonprofit management, and criminal justice. Nilda works directly with victims of human trafficking and sexual abuse with the amazing More to Life Foundation and Open Doors Outreach Network provider. While working and advocating, Nilda continues to volunteer in the community and be a mentor. Nilda, go Bulls. All right, so we can go ahead and get started. Let's begin. Sex trafficking is an egregious crime in which a commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such an act has not attained 18 years of age. An important distinction here is that when it comes to minors, the elements of force, fraud, and coercion need not be present for the act to be considered child sex trafficking. Any commercial transaction with the minor where something of value is in exchange for a sex act is considered commercial sexual exploitation. Commercial sexual exploitation of children occurs in many forms. However, in today's webinar, we'll be covering or addressing those that affect boys and male identifying youth. And the conversation will be inclusive of Black, Latinx, Native American, and LGBTQI youth. Before we begin the conversation on sex trafficking, we do want to take a minute to mention that most researchers in the field all agree that labor exploitation occurs far more frequently than sexual exploitation. However, is much harder to identify and to prosecute. With that said, the focus of today's webinar is to educate the community on the forms of sex trafficking affecting male identifying youth and young adults. Typologies of commercialized violence we'll be discussing today include sex trafficking of a minor as defined by the Trafficking Victims Protection Act, coercive and circumstantial survival sex, and commercial sexual exploitation and trafficking of young adult males through force, fraud, and coercion. Several credible national research studies have reported that as many as half of all child sex trafficking survivors identify as male. Groundbreaking research by Dr. Meredith Thank of the Urban Institute found that the majority of sexually exploited youth in her study identified as male. Furthermore, in a study released in 2020, Interpol, in collaboration with the National Center for Missing and Exploited Children, reported that the most severe forms of online sexual exploitation occurred or happened to boys and very, very young children. So we're going to start with questions to John and Nilda today. John and Nilda, you both work directly with boys and male identifying individuals who've been trafficked. How does the definition of trafficking and the typologies that we just mentioned affect the youth that you serve?
Well, thank you, Nathan. Nilda, I'll go first, and then you can fill in the gaps. I think that narrative, and that's why we're here today. Oftentimes, the narrative, when we talk about human trafficking, it is most of the time we include the female within that definition. Our minds typically will go to that place where we typically, when we talk about human trafficking or sex trafficking, the female's first that comes to mind. And so we have to change that narrative to ensure that we include both boys and men in that conversation. And so when we deal with boys within our organization, a lot of times these boys don't even know they were victims of sex trafficking because we, again, don't allow them to be victims of sex trafficking. And so the majority of the boys who we come in contact with through our home, they don't know the definition of sex trafficking. They don't identify as a victim of sex trafficking. And so we don't force them to take on that title, but we also recognize that if we can't change the conversation to include the boy as a victim of sex trafficking, then we're doing a very great disservice to these victims who are out there. It's a very underreported amount of boys that are being identified, and it's not because they're not out there. It's just because our way of identifying them isn't always the most successful way. And also the boy isn't allowed to come out as a victim, and they don't feel as though they have the ability or the freedom to self-identify and to come out and seek some help. So that's the biggest hurdle that we see when we look at that definition and we talk within the community around the state of Florida about boys being victims of sex trafficking.
Thank you, John.
Yes, and just to piggyback off John, I completely agree. Unfortunately, the boys were raised to never say they were a victim because men cannot be victims. And that's, as an advocate and mentor, that is, what we do is try to educate them and explain to them what the definition of human trafficking is and where their story falls into that. And working with boys in the community, one of the things I have noticed how they're, defining, a boy in trafficking compared to a female is a lot of their stories are different than the girls and how they're lured into trafficking, by the gaming systems and the internet platform, social media. So it can look different from a female. But that's breaking down their story and showing them where did the entry point come from.
Right. Okay. And Marta, I'm going to send this to you. Can you share on how this affects some of the more marginalized populations, unaccompanied minors, immigrants, or any of the other populations that you serve?
Can you hear me okay?
Yes, ma'am.
Okay, all right. Well, vulnerable populations, as we know, anybody who is experiencing a lack of resources, human capital, social capital, without somebody to lean on, undocumented folks, people who don't speak the language, any type of barrier to communication or stability. So including LGBTQIA communities, folks that no longer have support. So when there's that vulnerability, of course, then folks have the opportunity to create communication, create a relationship, and masquerade that as a form of assistance, and therefore making that person dependent to them. And there goes the relationship. So we see an attachment that happens for these populations because it's their only source of somewhat safety, even if it's a roof over their head for that moment.
Thank you, Marta. And Nilda, you spoke on entry points. So I think we'll send this to or ask all the panelists, in your experience, what are the unique risk factors and vulnerabilities experienced by this population? And are there entry points that are unique to boys, compared to female identifying young people?
Yeah, so some of that, from working with the males in the community, a lot of stories sound familiar, and they've met their trafficker through a game. Our boys that's what they like to do today, gaming, and they're talking to all these individuals, not knowing who they're talking to online and social media platforms, Facebook, Snapchat, Monkey, and also employment. Unfortunately, our boys are driven by, I want to work, I want to make my own money. And unfortunately, they meet individuals, their peers, who like, hey, I have a job for you, but turns into some kind of sexual trafficking. And unfortunately, our boys also are looking for attention, love, and belonging.
Yeah, and we've got somewhere between 5 billion social media accounts worldwide, and of that, there's almost 6 million of those are for kids under the age of 13. So 6 million kids under the age of 13. And so we look at those social media platforms, Facebook, all the big ones, Instagram, the large ones, and when a boy is on there talking. Again, because we don't educate boys on what trafficking is, because again, that conversation typically, includes the female. So when the boys are being groomed and being trafficked through social media, but that grooming process starts, they don't often see the red flags because we don't educate our kids, our boys specifically, on what to look for. We oftentimes, when a girl runs away from home and she comes back with her hair done, or she comes back with nails, the question may be, who paid for that? What did you have to do to have that happen? But when our boys run away and they come back after a week, but they don't look like they've been living on the street, they may have new shoes. Sometimes we don't ask those questions. How did you survive? Did you have to do anything to have a roof, to be fed, to get those shoes? And so allowing, again, those questions to be asked of our boys, the same questions we ask of our girls when they go missing or they have these red flags.
And if I may add to that, John, also when our boys run away and they come back with something new, the first thing that actually jumps to someone's mind is, what kind of criminal act are they getting into? And instead of actually digging deeper and asking, what is happening? Where is he running to? And who is supplying this? We automatically assume they're selling drugs or in a gang for their own wants and not being forced. And in reality, they're being forced.
Sure. Marta, did you have anything to add on that?
I think that's a great point, Nilda, that we're only identifying what we have been socialized, right, to discuss, to think about when it comes to boys or people who identify as boys. So if we're stuck within our own rigid thinking, right, of what boys do, then we're not exploring what harms they might be experiencing. So thank you for bringing that up.
Absolutely. You know, and I think we alluded to this too, when we think what do boys do when they're leaving, and things that we associate with the males that leave or that run away: criminal activity, substance abuse. And when we look at risk factors, substance use, misuse, and abuse is one of the most prominent risk factors associated with male exploitation. And there's really such a strong nexus, this intersectionality on many levels. You know, we know that boys turn to drugs to blot out or numb their abusive realities and toxic families of origin or choice. We know that caregivers and parents will trade or sell their boys to support drug habits. I think where the gendered nuance.
Did we lose Nathan there?
I think we did. So until he's able to add up, John, do you kind of want to comment to what Nathan was saying?
Yeah, I'm glad that happened to Nathan and not to me. That's usually me who freezes. And good thing he's not in a strange position. Yeah, again, the boys are individuals who identify as male. I was trying to follow Nathan as well as try to follow these notes. And so I don't know exactly where he left off. But as we look at these boys who are victims, including, again, them in the conversation, and ensuring that we look at these risk factors, and he was alluding to the substance abuse and individuals who are under the influence, and he's back just in time as I danced around.
Woo! I'm so sorry. I have no idea what happened.
John came in to save.
Thank you. John, did you need to finish, or did I need to?
Nope, I was dancing, waiting for you,
Sure?
and now you're back.
All right. I don't know where I was really the intersectionality with substance dependency and that clear nexus. And I think the point I'm trying to make is that I think there is a gender nuance that affects males specifically with substance dependency for those things that I was talking about in specific communities. So we know that from my experience operating the program that I ran for male survivors, crystal meth, for instance, was more often associated with the exploitation of the LGBTQ young people. Molly and Flocka was more often associated with Black male youth. Opiates and crack cocaine were many times associated with those that identified as heterosexual. So when you approach us from a public health lens and you really look at those nuanced differences, there are opportunities for targeted intervention within the treatment vertical. All right, so we will, let's see. Martin, I know, again, on those, from this public health perspective, and I know you have experience at the intersectionality of HIV and STI. You want to share anything about how that specifically affects this population?
Yeah, most of my work was in working with folks that were experiencing what we would call adjustment disorders after they had been transmitted the disease. And so when the intersectionality around STIs, HIV, and then we add in substance use and vulnerabilities. So we would see folks who came in after, transmitting the disease. And the experience, first we're talking about mostly adjustment or acute stress disorder, and not necessarily working on how it was transmitted. That was just an aside. But most of the time the conversations would include some type of coercion or force, right? Or survival sex. But without developing their narrative for them, telling them that they're a victim, more really just focused on, how can they use whatever resources they have now to move forward, to get the help they need, to get the healthcare they need, and work around all of the different symptoms that one experiences in acute stress disorder or adjustment disorder.
Sure. Thank you, Martha. All right, so we're going to, we touched on a high level prevalence when we first started, so we're going to get a little deeper into prevalence here. In addition to the numbers that I mentioned at the very beginning, ECPAT, Love 146, the Departments of Justice, Health and Human Services, the National Center for Missing and Exploited Children, all have published research, all have done work around this. And, according to those, anywhere between 30 and even 55%, if you take into consideration Dr. Dank's work on the streets of New York, that this is significantly affecting this population. Between one of the more powerful studies was the National Center for Missing and Exploited Children between 2013 and 2017 identified 565 male minors who were likely trafficked while they went missing. That's a large number, and that's the youth that were identified, right? In addition, I wanted to share there's a National Library of Medicine, a publication titled "Sexual Victimization of Men in America: New Data Challenges Old Assumptions," found that 10.4% of males in juvenile justice had been victimized by some sort of sexual victimization while in custody. Now, specifics around what type of exploitation that was, or if it's trafficking, I think the point here is that the sexual exploitation or sex trafficking is a part of a much larger or greater pandemic of violent sexual harm affecting boys and men. I think it really goes down to if we can wrap our brains around that this does happen and it happens frequently across systems, then we can begin to mobilize communities and shift those mental models away from that female-centric to a more inclusive. Marta and Nilda, the language we use, I was talking about language matters and how we identify. Can you tell us what phrases or words that you believe or that you've experienced may lead to the under-identification and misrepresentation of this population?
I make sure to use in any of my assessments unwanted sexual contact, because if we use the words raped, sexually assaulted, sexually abused, and whatever the gender identification is, if we don't identify the label, if we don't identify with the label, the what we're calling it, so the best practice would be to really more explain what we're talking about, what we're actually asking, and that is, was the activity unwanted? Did it feel pushed? Did it feel coerced? So instead of using language that somebody may not identify with, it's important for us to change the language in, all of our materials, in our research, to more accurately identify the unwanted experience.
Sure.
Yes, when meeting with a male victim survivor for the first time, the number one thing I've always done is trying to change the language. I don't want them to feel uncomfortable or make them feel like this is something that they wanted, because unfortunately it wasn't. And instead of using the word rape, because again, boys and males are raised to believe that they cannot be raped and it's impossible for them to be raped, is using the content, unwanted sexual acts, unwanted physical abuse, or unwanted mental or emotional abuse. It's breaking down that definition to them and showing them that it's okay to admit that you were hurt and that you've been going through something, because this is not okay. Someone has done harm to you. And it's just building that rapport with them to show them that they're not alone. And also getting away from the "I understand" statement. Not everybody understands. Not everybody knows what they've been through. And and a lot of times, working with the males, they say it. They've been in rooms with people saying, "I understand what you're going through," or "I know what you went through." Do you?
Yeah.
No, I can add briefly. Another aspect of this, even when we're talking about changing the language to unwanted, there are aspects of the connection that maybe was wanted. So even that can be confusing. What is it that you experienced? What parts of it did you not feel comfortable with? What aspects did you feel like you had to engage in that? So we don't even need to assume that the whole thing was unwanted, right? Because there's aspects that maybe were. So because in assuming that as well, we might be coming in and saying that it's bad or it's wrong to want to connect to another, male identified person, for instance. So we want to skew away from anything that might lead to language that might denote judgment.
Right. And I think too, especially with female perpetrators, right, there might be that sense that if I didn't, well, this is normal, this was natural, it wasn't another man or a male. So did I want that? I mean, I think they're, Marta, that you're right on point with that nuance. But there's also the biological response, right? With that can really confuse males. Well, there was an erection, so I must have wanted this, or it must have been my fault. And it makes it really challenging to talk about. I will say that in the study that I mentioned around Department of Juvenile Justice, the initially question was the word rape. And I want to say it was a 0.2 or 2% disclosure. When they reframed those questions to unwanted sexual advance, staff sexual misconduct, and made to penetrate, it went up to 10.2%. So that language is really, really important. John, kind of along those same lines with what we were talking about, there's a lot of there's misconceptions out there around the sexual orientation of male victims. Do you want to speak to that, with regards to the boys that you're serving, what you've seen?
Yeah, and it goes back to kind of where we started at. Why boys don't come out as victims? Why don't they self-identify? And some of that is because, I've picked up boys who were verified victims of trafficking, and they get into the car, and one of the first things they'll say is, I didn't like what I did. I was forced to do what I had to do. And sometimes, we automatically think that all boys that are being trafficked identify somewhere on the LGBTQ community, but that's not necessarily true. Some of the boys that we've come in contact with were forced to do things that they may not have done if they weren't forced to do it. And so they may have participated in homosexual acts, although they identify as heterosexual. And so there's that fear that if I come out and tell people what I've been doing, not only are they going to label me maybe a victim of trafficking, if they even know what that is, but they may label me as an orientation that I don't identify with. And so some of these boys, they call it gay for pay or gay for trade on the street. And so these boys will identify as that only because they're in survival mode a lot of times. And it goes back to that survival sex and on the street trying to find a way to survive. And with the lack of a family structure or lack of support, they end up on the street. And so they've got to do kind of what in their eyes, they've got to do what they've got to do. So they may not identify in that community. But we as a society, we want to label them that. Even if that's not something that they embrace. And so we've got to get away. And I appreciate what you said, Nathan. I kind of maybe got buried there for a second, but females are buyers too. And so, not only do we have to change the narrative allowing boys to be victims, but also we have to change the narrative of buyers are both male and female. And so we've got to, again, include that in the narrative.
Sure. John, I'm glad you mentioned that, because we're gonna talk about that for a minute. If we were talking about Johns, we need to start talking about the Janes, because you're absolutely right. Females both traffic and purchase sex from boys and girls. We're barely talking about, or just now talking about, the trafficking of boys. So I think it's just the evolution of the movement. We're not there yet. But I can tell you from working with this population, there were many survivors who were sexually exploited, purchased or traded or bought by female, and as well as transgender and non-binary. I wanted to share a few things on that. I think for people, and when they're wrapping their brains around the content and deciding how to act, a lot of times is this just an anomaly? Is it just an outlier? And it really isn't. It happens quite frequently. In the Boys documentary, Judge Robert Lung actually shares how one of the pedophiles in his trafficking scheme were identified as a woman. The McCain Institute for International Leadership, Arizona's State University's Office of Sex Trafficking Intervention Research, published a study. They analyzed 1,400 cases. Of those 1,400 offenders, 24.4% identified as a female. And so I will acknowledge that many times that's part of the scheme. Females are many times forced into trafficking, or they're normalized, and their terminology for that. But we need to realize that females are trafficking these boys, and they're purchasing sex. There's the movie Magic Mike, for Pete's sake. I mean, it's not that there's not a demand for sex, right? I think it's just we need to move past that binary narrative that we have. and there's more conversation on that. I want to make sure we have other time for everything else, but I'm going to send this back to all the panelists again about misconceptions, about when we're talking to people in these misconceptions. Where do you think those misconceptions come from? What are we not doing right that kind of lead to or help create perpetuate those narratives?
Well, I think
Homophobia and transphobia is going to be probably the first conversation around that, right? So any conversation that that we engage in, any narrative that we engage in, where we view anything that's feminized as a pejorative, as a negative. And so we have to identify as an orientation, or I can't talk about it because this is something that we don't discuss. And so masculinity, and women also perpetuate these things, right? We perpetuate how we socialize boys, men, and women around these issues, what we can talk about, what we can't talk about, and how we can perform masculinity, right? Gender is a performance. How do we perform that role? And there's certain things we cannot do to perform the role of masculinity.
Anyone else on that? All right, so we've covered, what are the typologies that are affecting specifically this population. We've kind of unpacked what the unique risk factors and vulnerabilities are. I wanted to send this question, so we have a little time, to those that are working with the population. What are the channels or the venues that you're seeing, that these boys are being exploited? These boys are being exploited in. Where are they being exploited from?
Do you mean, Nathan, sorry, do you mean specifically the entry points that we were discussing?
Well, we talked about, online, is it, from the parks, the bus, massage parlors, the venues that we hear of females being trafficked. If someone's asking, well, where are the boys being trafficked? We don't necessarily see them all the time on the corner like we see other forms of trafficking.
Yeah, Nathan, I would say that the majority of the boys that we come in contact with were all exploited through some kind of social media app, dating websites. Most of it's happening obviously on the internet. We do see some of those traditional stories where boys are forced to work a track, boys are forced to work the street. We do still see those stories, but we also, the platforms are typically, online. Boys are being forced to put themselves on Tinder, Bumble, Let's Skip Lunch. Some of those major websites, we know, the back page was shut down, but that only opens the door for other websites to open up. So the majority of these kids, and sometimes what's really confusing, and when we talk about trafficking, we've got to include this again, sometimes there's not necessarily the presence of that traditional trafficker looking individual. There may not be a traditional pimp. There may not be somebody who's kind of that third party, but the kid, it's the child and the buyer. And there may be that absence of that. So we see a lot of our boys with an absence of kind of that traditional trafficker or that traditional pimp, putting themselves on these dating websites. And so we've definitely got to educate our kids on how to use the internet safely and how to be aware. I've got a 13-year-old boy and a 4-year-old girl, and I've got to talk to both of them differently about what to look for when they're on the internet, because again, we've got to educate the kid. We've got to make sure that they're aware of what to look for.
Nilda or Martha, anything?
Well, I think the panelists are doing a great job of communicating, internet apps, social media. Nilda had said that earlier, right, on gaming, but schools, sports, I'm just reading what y'all have said, but family, gangs, right? Nathan, I'm just moderating over here, sorry.
I would say one of the big ones is the peers. Our youth are driven by society and are driven by what is the new and what is happening right now in front of me. I want it. I want to have it. How can I build a platform? And unfortunately, everyone has mentioned, schools. because the kids are talking about the next best thing and how can I have the next best thing.
Right. No, and it's always interesting to see other providers in different regions, even in different populations, what they're seeing, if they're seeing any trends. So in preparing for today, I actually went back and reflected on the last 8 years and the survivors that I've worked with, whether that was street outreach, online based, here in Florida, as well as out in Texas and other regions. And I looked over previous training sessions, and I looked at the questions, like the most challenging things that people had responded. What were they having a problem with? And it was always, well, we don't see it like we see it with females. We don't see on the corner. And so I took all of that. And so when it comes to, the type of trafficking or, that many recognize that others, females experience, boys are, they're trafficked through force on the street or in, mainstream discourse, we call it pimp facilitated. Out of families, so we know that caregiver, we touched on that before, familial, peer facilitated. The most trending now that we're recognizing is sextortion through text, online channels, and gaming systems. The drug facilitated type of trafficking, and then with survival sex, if it was, if the person was over 18, whether that's circumstantial or coercive. And then I looked at the channels or the venues where the boys are being exploited: massage parlor, bathhouse, nightclub and bar, street-based or in the community, rest stop, park, bus terminal, dating apps and websites. There was one traded on the dark web, group homes, homeless shelter, a free clinic, a medical clinic, detox and treatment centers, correctional facilities, schools, as you had mentioned, churches, and again, in private homes. So I think the point that we're building here is that this affects youth along the gender spectrum pretty in many of the same types of forms. We're just, as I think Marta alluded to, we're so normalized to look for something in a certain way. We haven't been trained to look for this. But if you look at the risk factors about the individual, family, the community, and societal level, the risk factors that can lead to the exploitation of girls and women, you'll see that boys and men experience those same risk factors, and in some at higher rates, traffic in the same venues and in the same forms. So we're going to go ahead and move now. We've shared a lot of information with the audience, and we know that there are providers and those working with the population seeking, okay, what do we do with this information? And so we're going to give the panelists an opportunity to kind of share what their service responses have been, what they've seen successful. I'll share, and then we're going to share some examples of other organizations that have kind of mobilized, maybe pivoted their approach to be more inclusive. So I'll start with, Giant Slayers, I provide technical assistance and training. And so on the research front, the Community for Sexualized Harm out in Sacramento, California, they got a grant to really measure the scope of sex trafficking across Sacramento. Leadership realized that they did not have the expertise to identify male and or transgender. And so we were able to go in, review those research instruments, and identified several opportunities to make the language more inclusive. So for instance, male and even the trans population were not identifying with pimp by and large. They were identifying with, escort, friend, mom, and there were other terms. So the point being that even from, as far upstream as possible at the research front, looking at those, the language that we're using and the tools that we're using to collect data can make a huge bit of difference. Christie House out of Miami is a gold star example of a traditionally female-centric or serving organization that pivoted their approach to be more inclusive. They basically partnered with a male serving provider as a sub-grantee on a federal grant. So they were still holding true to their mission, and then partnering with the male serving provider to identify boys and men. Out of Atlanta, an opportunity to developing prevention education for teen parents within the child welfare system. No one had thought to think of teen fathers. They weren't even asking the question. We did some research and then identified opportunities to make that prevention education program more inclusive, specifically of teen fathers. Many times it's really taking the time and investing and prioritizing top-down or top-level leadership, that this is going to be a priority in our community. How do we do that? We take time and we map out our community, we map out our systems, the actors within those systems, and really go through each system and sector and say, okay, from prevention, from primary, secondary and tertiary prevention, where are the gaps within each sector where our boys are falling through, bringing that system together and really creating a regional or a county, a strategic plan with time constrained metrics that to make a difference. So those are some of the opportunities where it is possible. People are, organizations and responsible organizations are mobilizing. So I'm going to turn it over to the panelists and talk to us about your service response. How has your organization either mobilized or expanded or pivoted to ensure that this population is being served in a culturally relevant way?
Well, I'll start with at the U.S. Institute Against Human Trafficking. When we opened our safe house for boys, kind of referring to, Nathan, what you were talking about, we didn't have anybody to go to at that time to figure out how to run a safe home for boys. And so we based our home off of what some successful girls programs were doing and kind of built it from there. And once the home started operating and boys were coming into the home, realized how different boys are from girls, not just boys from girls, but even, survivor boys from girls and what they need and the population that we were serving. So we've organically moved and changed to where we are today to better serve the population of boys, to ensure that they have a safe place to go. Again, we don't force any labels on our kids as far as they have to, identify as victims of trafficking. If you went to our home right now and said, "Are you guys victims of trafficking?" Most of them will tell you you've lost their mind. No, I'm not a victim of trafficking. But we know that they are. And so part of our operation in our house is to just educate on what trafficking looks like and how to go back into society and operate and be a pro-social individual, be able to identify the red flags, to be able to identify what's going on. So our home has organically changed. We lean heavily on DCF to identify these individuals, the community-based centers throughout our state to identify through the trafficking screening tool. We know that may need some adjustment as well to ensure that because boys' answers are a little bit different than girls' answers. And so making sure that these boys are being identified in the community.
Thank you, John.
So at More to Life Foundation, which is part of the Open Doors Outreach Network provider, we serve the ages of 10 to 24 years old, male and female. And our, each youth that comes to our service program is paired with a survivor mentor. So they're walking along with a mentor. And the survivor mentor is building that rapport with each individual youth to educate them on what's human trafficking, what are some of the identifiers and the vulnerabilities, and how can we help them succeed. One of the things at More to Life is we work with a lot of organizations in the community to provide that face-to-face contact, direct care service, like United States Institute Against Human Trafficking. And we are starting to bring on male mentors so they can have a male mentor work with the males, because also our boys and men have to know, what does a man look like? What is a man of honor? Because unfortunately, a lot of our females and males don't have an understanding of what a role adult model actually really looks like. And that's why we're, the survivor mentors and the regional advocates and our clinicians are here to do is help our survivors through their journey succeed while identifying what their triggers and their traumas are.
Thank you. Marta, I want to specifically ask you, I know you have experience working with youth of transgender experience and non-binary. Are there what have you seen, successes in the field, specific barriers, that may be unique to the population, and what works? What do providers need to know?
I think we're still working on updating our language around health care. So that's one area that I think is a barrier, is how we discuss reproductive organs, how we identify those when we're asking questions about updating our screenings for, cervical cancer, and where's our outreach to? Is it only to female identified people, instead of using people who have a uterus, or language that identifies the body itself? So healthcare is an area where we could update our language and how we do that outreach, those quality measures. And the same thing goes for, I see that there's a lot of foster parents here in our discussion today. So what is important to know about reproductive health for the kiddo that's in your home? Is it a trans male, but are they possibly pregnant? So we want to make sure that we're providing that healthcare to them, and that's pretty specific to the trans community. Is just, again, moving away from the structural norms and how we've been socialized to think about gender and not within the binary, especially when it comes to the body.
Sure. And I wanted to ask you something else. Knowing you work with this population, can you speak to the higher rates of victimization, or some of those disproportionate, or those unique vulnerabilities that this population experiences?
Well, in the clinical setting, when I see them come in, I think the narratives are pretty similar when it comes to how they, harm doers can engage in attachment, right, in grooming, and what is it like for this population to not feel, or this community to not feel accepted, to feel gender dysphoria about their own bodies, and to have the gender, or how they identify themselves in their body. They have somebody who knows that and can prey on that in order to create that connection and exploit them. So just the vulnerability around the body and gender dysphoria. And again, vulnerability, lack of finances, lack of homing, lack of assistance.
Right. No, thank you. And I will just take a minute to mention Survivors Pathway out of Miami is a partner that we've partnered with in the past that effectively serves one of the few trans survivor-led organizations, for those that didn't know. So John, can you share with us then, I know you're based out of Tampa, what's your referral network? Who else is serving this population within the state of Florida?
Well, I think you've named some great providers and some individuals who are doing some great work in the state of Florida and nationally, specifically for our boys. Unfortunately, there's not a large resource page for boys, because it's still, in Florida, I think we're ahead of the nation when we look at some other states that have zero services available to boys. So in addition to some of the ones you've mentioned, we know that Devereaux, More to Life, redefining refuge, those kind of organizations are doing some great work in the realm. Here in Hillsborough County, there's a plethora of different organizations that are reaching out to survivors of trafficking. As you stated, somewhere between 30 and 55%. We feel comfortable with that 36% of minor victims nationally are boy victims of trafficking. Here in the state of Florida, it's somewhere between 15% of minor victims of trafficking identify as male. And so we have 5 beds available. There aren't any other beds available that we're aware of here in the state of Florida, or specifically available to biologically born males of sex trafficking. And so we need to increase those resources. And we know that conversations like this help spur that and ensure that these, it's not enough just to identify the boy, but we have to also provide services to the boy. We have to have those things available. And so we've got to continue these conversations to ensure that the bed count increases.
Sure. Thank you. And Nilda, I wanted to ask you then, so if someone's watching, or for providers who weren't aware, if it's a parent, what should someone do? What are the steps if they think they've been exploited or trafficked, or they know of somebody who's trafficked? What's that look like? And then what's your referral protocol?
So if you believe someone is being trafficked, I always refer them to Polaris hotline, the human trafficking hotline, or they can reach out to, their local DCF abuse hotline. But at More to Life, it's a simple referral form. They can reach out to us online or send a request to the referral at moretolife.org. And once we receive the referral, we would start the processing, referral processing, and meet with the youth face to face and assess the needs of the victim survivor. But there's many organizations around here who can provide that on-site services as well. But More to Life can definitely be one of those organizations that can meet with the families, foster homes, foster groups, case management organizations to help identify if trafficking is actually happening.
Thank you, Nilda. So we have a couple more conversation points, and then we're going to transition over to questions. So I'm going to ask all the panelists that now that really a summary in your opinion, from your professional lane, how does the movement need to? How do you think the movement needs to shift so we're not having the same conversation next year? And I'll start with actually whoever wants to. No specific order.
It's such a huge discussion, right? Because if we know that vulnerabilities, right, are essentially the things that people are using to prey on, and people need to survive, or makes them vulnerable to exploitation. So, how do you have this conversation about, well, we need to fix poverty. We need to do all of this type of prevention in these other areas. So not only do we need to work on moving away from this binary idea of gender that pits us into these performative roles that create barriers to disclosure and creates barriers for providers to creating appropriate and inclusive care. But how do we talk about, okay, well, we need to fix all of these issues that create vulnerability. So it's such a big discussion, but yes, we need to help the people in this economy. So that's one of the conversations. We need to increase care. So we need to go from this big macro conversation, right, to this micro conversation about specific resources, specific type of care and treatment.
Thank you. Sure.
Yeah, I definitely agree. And we know that trafficking is simply a supply answer to a demand need. And so if we can fight the demand, there's no need for the supply. But also if we can educate our children, and I know here in the state of Florida, it's been a mandate through K through 12 that there is some kind of a curriculum of trafficking for public schools. But we really have to educate both boys and girls on what trafficking is, what to look for, the process of grooming, what that looks like. But I think, we've got to start there. If we can educate the supply, then hopefully we can stop the demand by having these kids aware of what's going on. And so I believe that's, a very small thing that we can do, but would be very powerful for these kids.
Thank you, John.
And if I may add, education. Not only do we need to educate our youth, our children, but we also need to educate the parents. Our parents need to know the different types of social media, the apps. And I understand in today's society, we've become so busy. We're constantly moving, work, school, we're trying to, evolve and trying to build our home from the home front. But parents need to, take a step back and start actually paying attention to the children at home, because kids have so much time on their hands and their phone has become their lifeline. We need parents to start really checking or asking, hey, what's on your phone? Or what kind of apps do you have on your phone? If we can reach the parents and the families, I believe it's a trickle down from there. And I know here in Pasco County, with the Pasco County Commissions on Human Trafficking, they started an initiative to start throwing out information to families and parents. Hey, this is what's happening in schools. This is what's happening in our community. You need to be aware of some of the apps and social medias.
I just want to add a note here, on human behavior and human survival. And we can discuss prevention and education. And I'm so glad that there's a mandate on human trafficking prevention and education. When I was doing it, I was, kind of somehow putting that information into my prevention education for the state of Florida through dating You know, how do you date in a healthy way? But, and, you know, also not get trafficked. So we can educate people all day long. But if we are hungry, if we are unhomed, we can know that this is happening. We can know that we are vulnerable, but we still need to eat. We still need to find shelter. So education is fantastic, but I think for us to not have the conversation next year, we need to do something about those vulnerabilities. We need to provide that care. So if they don't have their needs met, then our job is to create a system that will meet their needs. If their caretakers won't do that, or if they are coming to find safety from another country. So we have got to create that here.
Yeah. Now, thanks, Marta, for that point, because, you know, we hear about demand reduction, right? What we don't hear enough about, if you're approaching this from the economic supply and demand, we need to pivot to, you know, in demand, we need to empower the supply. And that's what I'm hearing, and that's the approach. I think it speaks to your point, Marta. We're not going to arrest our way out of trafficking. And if you lock the pimp up in jail, it still doesn't give me a home. It doesn't give me food. I'm still hungry. And so I don't think we have to do one or the other. I mean, the initial TVPA was created so that we're focusing equitably on prevention, protection, and prosecution. And I think over the last 20 years, we've been just focusing on that prosecutorial piece. So demand reduction, absolutely. We need stakeholders in the field reducing that. Concurrently and equitably, we need to be focusing on empowering the supply, addressing those specific vulnerabilities that are specific to specific populations, targeted interventions. And I think it really speaks to, again, pivoting our approach. What needs to happen is this public health approach. So many of us are looking at this from this criminal perspective, and we have, you know, there's the safe home, which are incredibly valuable. I do think if we started looking at the other social determinants of health, the vulnerabilities, the risk factors that the different populations experience, we can develop targeted interventions to economically empower trans youth. For instance, to Marta's point, substance dependency, trauma-informed substance dependency treatment for males that are exposed to drug-facilitated trafficking. So, you know, how do we need to shift? I think we need to shift to this public health approach to prevention and early intervention, as opposed to just having all of our resources on the after effect. And then again, I think to Nilda's point, that the two-generation approach, I think everyone really spoke to this, is there are models that we can adapt. A two-generation approach, yes, we need to empower the young people with prevention education that's evidence-based, that's gender inclusive, that's a public health model, that's LGBTQ inclusive. We need to concurrently be arming the caregivers and parents and entire school system staff. One of the examples of that is the Not a Number curriculum, and I'm mentioning that because I saw it in the chat box. Awesome. It checks off all those boxes that I just mentioned: gender inclusive, evidence-based. It's a whole system response. So they have the curriculum for the kids, but they also have comparable for caregivers and whole system staff. So I just wanted to kind of piggyback on the panelists, their responses there. And then I had my own, and this is from, I rarely use the term anymore, survivor. I have lived experience, but when I respond to this, I take into account others that I have in my close network that are males with lived experience, that are in the field, that are challenged, that have been working in the field, and we look for the most, what are we seeing at the macro level or first steps? We've got to look at marketing communications. So and I need you to maybe hold space or look at this from a male survivor's perspective, looking at your organization and looking at your marketing. When we see a website or when we see a brochure that is all female and there's like the picture of a guy in there, like it's an iStock photo, that can be trauma reminding. That can internalize feelings of shame and stigma associated. Well, why did this happen? It made me weak or more like a girl, because that's not what I'm seeing. And it perpetuates, it helps to create this false narrative in the community. And so it's not an attack on any organization. Again, I think it's the evolution organically of the movement. We're learning more, right? And this is why we come together to learn how to do better. Much of the success that we have within the female or organizations serving females is because someone said, hey, we probably should start listening to female survivors if we want to really know how to effectively serve the population, right? There are many well-heeled males with lived experience that are available, that provide consulting, and that can come into your organization and help you do it the right way. I don't want to speak for anybody, but I don't think anyone on the call right now wants to harm a young person by trying to help them. So I think a first step is we've got to really we've got an audit. We've got to do a marketing communications audit to make sure that our collateral is gender inclusive, that it speaks to male survivors and transgender, non-binary in a welcoming way that's not tokenistic. Those are my 2 cents there. Did anybody have
I really need to add something to that.
Yeah, for sure.
We're not just the gender presentation part of it, right? But policy that inadvertently continues to harm communities. So the marketing part of the images that we're seeing, are we seeing only Caucasian, models on these brochures? Are we not seeing any funding or grants to Indigenous communities? Are we creating policies that inadvertently harm those oppressed communities? So again, both the macro, the big picture, and specific to the services and the marketing and the language that we use, and to which communities are we actually trying to speak to? So if there's no Spanish-speaking providers, right? If there's nobody that's knowledgeable in Indigenous communities, are you really able to provide inclusive services?
Right. Excellent point, Marin. Thank you. It's super powerful. Did any of the other panelists have anything to add? If not, I'm going to share again from fielding questions within the field of those with lived experience in serving the population. I have a few strategic recommendations for 2022 suggestions. But before I transition there, anyone else have anything to add before we go to questions and answers? And I think, Marta, you just alluded to that, legislative action specifically addressing not just male victimization, but you're right. We know that BIPOC communities or communities of color are many times disproportionately effective. Native American, Alaskan, and Natives are rarely represented when we even are talking about communities of color. We have grants that specifically are funded for women and girls. That's written into the language. That's what the grant is. And that's been incredibly beneficial to women and girls. And I think many times it's been beneficial to women and girls to the detriment of boys and men. And so again, it's not a us or them. We're never going to eradicate or even make, I don't think, impactful outcomes if we're not addressing this holistically and working to end this across the gender spectrum. Restructured funding models form foundations in communities. Many of them are still specific to one gender. Very few, I don't know of any that are addressing communities of color that are disproportionately represented by exploitation. We spoke to the male-centric granting. After sitting through and listening to this conversation, if you're the head or if you're part of an action or a coalition or a task force, we know that this is an underserved population, sometimes unidentified in communities. We know it happens a lot. And if we're looking at national estimates, let's say as many as half can be, okay, let's go with 35, can be males. Look at your numbers. If there's huge disparities in females identified and males identified, you got to ask yourself, what might we be missing? And all I'm saying is that with that level of concern, I think a dedicated task force or working group is warranted. Investment, leadership buy-in, and the goal of that task force or working group in each community is to come together, bring in male survivors and those that know what they're talking about, and create a strategic plan so that we're not having this conversation next year, so that next year we can come together and share measurable outcomes that what's worked in communities. we mentioned the gender inclusive prevention education. I know there's a mandate. There's charter schools in communities that don't have to follow that. There are other alternative schools. If you're in the community and you're a parent, or if you're an advocate, there are gender inclusive, evidence-based prevention curricula that need to be implemented. And not only be implemented and advocate for implementation, but we need accountability and oversight to make sure that of all of the students being empowered with this education, 70% aren't girls and 30% are boys. That's the level of investment and accountability that we're asking for. The substance dependent, and finally, the substance dependency vertical. When I was looking at systems, what system probably has the most opportunity based on what we've learned and the intersectionality between substance dependence and male victimization. From my experience and just working in the field, county and state funded drug treatment programs rarely have, how do I say this, need more training in trauma-informed care to serve for a male survivor, especially male survivors of sexualized violence. We go in, stop smoking crack, stop slamming meth, but you're not ever addressing the drivers of that addiction. And it's vertical. It's in the sober homes, the treatment centers, the detox, the recovery groups. So I think if you are in Florida, every sober home has to be, not everyone, there's a state certification board in Florida called FAR, Florida Association of Recovery Residences. A good policy agenda or a goal would be to include human trafficking education in order to get certified to operate a sober home and make sure that that's gender inclusive. So just some of the recommendations that we've heard in the field before, to move the needle along over the next 12 months. We're actually going to open it up to questions and answers now. I have not been watching the Q&A box, but I know there's several in there. Michaela, do you want to field those? Should I field those? How do you want to do that?
How about I'll go ahead and read them aloud and then turn it over to you all to make a kind of a mixed answer. Would that be okay?
Sounds great.
Okay, so from Chantal, she says, can you speak about the vulnerabilities of boys and girls in the foster care system in regards to their peers and caregivers? We turn that over. Maybe Nathan, you could start.
When you're saying the vulnerabilities, the peers and caregivers, is it the recruitment factor? Can that person expand on that, or just the vulnerabilities of those in the group homes?
We'll wait for them to, we'll go to the next one and then we'll come back to it if we can. Can you speak more to the use of substances, i.e. Viagra to maintain erections, poppers, etc., as a coercive method with boys and important of awareness of these methods?
I can speak to that. So within, and I'll use one community that I work with the most within the gay community, the crystal meth, P&P, party and play. There's just definitely a subculture that is involved with exploitation. Some things to link for. So PrEP is used within the community many times. It's an HIV prevention medicine, basically the simplest terms. We know that if you're looking for actual indicators of sexual exploitation, many times that was associated or that was evident, prevalent, I guess, with male exploitation. So there has been talk around prevention education around that. So if you are living with HIV or AIDS or you're receiving PrEP, then that would be an area for targeted outreach or intervention to explain about exploitation, sex trafficking. I don't know of anything that's been in place yet, but that's where the conversations are. I haven't heard anything around Viagra. I know that poppers are very prevalent, again, with the crystal meth. It's just part of the culture. But PrEP is the element of all of that we've seen more conversation around, and it's an actual indicator of exploitation.
And when you say PrEP,
HIV, sorry, the Ryan White grant,
yeah.
That collects the social determinants of health, collects data. It's one of the grants that I worked under when I was providing clinical support to the population. So they're going to have quite a bit of information on that data and how substance use connects to that, especially in the prevention. If you're looking for prevention information around the ages between think it's 18 to 24, which tends to be a population that experiences a higher rate of transmitting.
I was going to say, just to clarify for some folks who may not know the reference to PrEP, that's post-exposure prophylaxis, typically for HIV exposure. I just kind of wanted to mention that as well.
Yeah,
Let's see. There's a question here from Jasmine. She says, do you feel that calling buyers/child abusers Johns and Janes minimizes their acts of child abuse and their role in the exploitation?
I move away from labels, period. So if we're identifying something, I'm identifying the action, those who sexually abuse, those who engage in harm doing.
I think that's sort of an interesting, because it's very much a binary response. And I think that just what you were talking about before in terms of our competence and cultural competence in understanding the many different lenses when we talk about gender, sexuality, et cetera, that's an interesting point to make. Nathan or John or Nilda?
Yeah, I agree. John and Jane are some plain names that we use if we don't know how to identify somebody, but we know how to identify these people. So we identify the action as well. The buyer, the abuser. So
it doesn't necessarily, I appreciate your point, Michaela, it doesn't necessarily translate culturally either.
Yeah. Go ahead. Sorry.
No, I mean, if you're looking at it from the survivor perspective, there's working with the population, the word trafficker doesn't necessarily resonate with many of these people, of people being victimized or exploiter. I think it goes to that culturally. It doesn't, I think it depends on the culture and the type, the culture more so that you're working with, what terminology you use.
Okay. So kind of following up on this in particular, and I think Nathan, you were talking about that there's a wealth of knowledge from survivors in the field. There's a couple of questions about, what are some ways we can help boys to overcome what has happened to them and move past it, and how it is that we can include survivors in the leadership and development of these types of interventions, prevention, et cetera. And so I'd like to hear from you all some of your suggestions for those of us who are in the audience that are really interested in working with more survivors and ways to develop those relationships in an appropriate manner that really, values the experience, professionalism, et cetera.
From a clinical perspective, I'm not helping them overcome or get past necessarily. I'm helping them get back to baseline before trauma. Helping them cope with the symptoms of stress disorder, PTSD, and helping them reduce the intrusiveness of the thoughts, the memories, flashbacks, the anxiety that comes with it, the behavioral dysregulation that folks engage in with stress disorder, right? So that's when we start to see folks acting out or engaging in harm, self-harm, suicidal ideation. So from that perspective, and we can even use this for parents, for caretakers, for foster homes, service providers, is helping them develop the skills they need so they can manage the symptoms that are associated with trauma. And so putting the focus less on, helping somebody get over it and more of, let me teach you skills that will help you now and will also help you regulate later.
Nova Southeast. Go ahead.
Sorry. In that much of life, we pretty much have the same approach. It's building those basic fundamental life skills that unfortunately a lot of the victim survivors lost along the way. The basic needs, like the cooking, the money management, the budgeting, getting them, just those simple life building blocks that they need to work while working through their trauma. And then to get survivor leaders more involved is reach out to your local organizations that currently work in the field. Reach out and see if they're needing assistance with volunteer work, or if they want or hiring, because having survivors, male survivors, come out more and be more interactive with a lot of these organizations could be beneficial, because the more male survivors that come in to help, the more male victims we reach.
No, I really appreciate that point about teaching them those skills, because that's the stuff that's really going to help them feel more confident and more independent in their decision making. So important. Thank you.
There's a program ARC was associated with or began to partner with in Fort Lauderdale, Nova Southeastern University. Their clinic, it's called the Trauma Resolution Integration Program. They do research with Yale University, and that was what how they taught us. It was, you're not teaching the kid to get over it. It's trauma resolution. You're teaching them how to tend to it. Was the words that we used. But I think the reality is this: we've got to create a safer space for men, for boys and men, to become actively involved in the movement, and it's not in many places. We still have men, and I still hear, I'm not going to never. So we've got to move away that men are bad and they're the buyers and they're horrible people, because that doesn't make a comfortable place, right? And we've already talked about women are also buyers too. So on a couple of different fronts, I think we need to invest. We've had 20 years again on creating what we see now that's been really powerful for females. Department of Children and Families, I want to say 5 years ago, I don't know if it's still in action, but they had funding to scholarships. It was for male social workers down at Barry University. We need to invest in training. So and identifying these male survivors, as Nilda was talking about. It's to the question that was asked. We need more male survivors. I don't think that we're there yet to where male survivors feel as comfortable getting into the movement. And the reality is that the trafficking incident may not be what they're most concerned about. They may resonate more with recovery from addiction, or living with HIV and AIDS, or peer support recovery specialists for mental health. So we need to broaden our perspective, and really, again, I'm going to keep going back to that public health perspective. What worked for ARC, we knew that there was a limited pool of male survivors within trafficking. So we looked at other recovery that the guys were experiencing, and we started building relationships within the 12-step recovery community, or the recovery community, the peer recovery support specialist, again, the HIV community. I think I know I'm babbler, I'm going over my time here, but I think really important is investing time in the communities and grassroots communities, and identifying representative from the community that you're trying to engage with, empowering that person or those people from within those communities, instead of going in it, we're going to go into that whole rescue mentality.
Yeah, especially culturally relevant and responsive work too, because trusting our communities to create services for their communities is very important. Thank you.
Thank you. And I think that really this kind of goes to Ariel's question, which I think it's pretty well answered, but they were asking about some ways that they can help boys overcome what has happened to them and move past it. And I think you just had a really good discussion about, I like the idea of attending to it, Nathan, that you had said, and Martha as well, you had, kind of talked about kind of returning them back to like a baseline level. So I think that's really good. And then there are, of course, also a lot of resources out there. I think, Nathan, you have some wrap up stuff to do. I think those questions, that answers most of the questions that we had there, unless I do have one more question if you're okay with that on the time, or if you'd like to just proceed.
No, go ahead. Yeah, we have about 5 minutes.
Okay, so the one thing that I wanted to ask was, I think in the conversations that we've had, we talked about sort of some of the roots of these issues that we're talking about. And I think Martha's point about, kind of it's a huge discussion going down to sort of a micro discussion. So what do you find, maybe, and I think maybe John and Nilda in particular would be able to answer this, is who do you find to be your strongest partners that are not necessarily focused on on trafficking itself, but other resources that help communities. And what would you recommend to others who are on their phone about, or excuse me, or on the webinar about, who are some of your most important partners?
Some of our strongest partners are, individuals within our community, educating themselves, the individual, on what human trafficking is. There's, human trafficking 101, education. So, that's a strong partner of ours, is just the community itself, but also law enforcement, because they come in contact with survivors, oftentimes not even being able to identify. It's hard, if somebody's pushing a pound or a kilo of something, it's easy to identify what they're doing. But if somebody's driving a car with 3 victims in it, it may be harder to identify. And so educating law enforcement, as I said before, Department of Children and Families is a large partnership with us. But again, just that individual within the community and education. We work with Homeland Security, any kind of law enforcement organization, and also the medical professionals. We know that these survivors come in contact with a medical professional oftentimes while they're being trafficked. I think that it's 80% of individuals who are being trafficked at some point come in contact with either a nurse or a doctor. And so educating medical professionals as well on what to look for, red flags, questions to ask safely, and what to do if they identify it. So those are some of our larger partnerships.
Thanks, John.
And, yes. So for us, a lot of our, our strongest partnerships that are not in the human trafficking, realm is, our schools, our children, employers. Like I'm taking it like, more within the community, because believe it or not, a lot of our victim survivors are being seen everywhere, and just a little bit of education awareness a light bulb can go off for somebody. And if I may, I know here in Hillsborough County, there's a group called Tampa Teens. You have teens teaching teens, and they're in the classrooms in the schools, and sometimes peers themselves can identify victims and survivors just by being a friend to them. But we work very closely with law enforcement, hospitals, primary care physicians, but an advocate, being an advocate in the community, I try to build more relationships with employers, libraries, case managers, because at the end of the day, our youth are being seen by somebody. And then just by building that awareness and teaching everyone you come across on human trafficking, they're going to have some kind of insight. So when they do see a youth, a light bulb's going to go off.
Great, thanks so much. I'll hand it back over to you, Nathan.
Thanks, everybody. This was awesome. This was powerful. Absolutely. And on behalf, we're going to go ahead and wrap it up today. On behalf of Voices of Florida, or for Florida Alliance to End Human Trafficking, our all-star cast of panelists, we want to thank you for a very productive conversation. If you have further questions, you can follow up with me via email. You can follow up with any of the panelists. I believe their emails are going to be being sent out. We're sending out an evaluation form and certificate shortly. And then we'll also be sending out some citations to some of the studies that we mentioned during our conversations today. I also know that Tiffany's going to be sending out additional resources that we've all shared with her, citations, articles, publications, contact information. And I believe that's all we have for today. Michaela, was I missing anything? Are we good?
No, I think we're great. I certainly appreciate the depth of the conversation that we've had here. I feel like our panelists we kind of got an all-star panelist here, and we're able to engage in a discussion that really went pretty deep. So I really appreciate that. And you're getting lots and lots of thank yous from the audience. So we look forward to our next webinar opportunity, and good luck to you all in your work. And we hope to continue on together.
All right, thanks, Michaela. Thanks, everyone.
Okay, bye.
Take care.